After more than 2 decades in the U.S. Navy, Dr. Chad Storch has seen medicine practiced in just about every environment imaginable, on land, at sea, and in the air. During his Navy career, he spent years aboard the USS Oak Hill, caring for sailors and Marines, managing everything from heat stress and hearing conversation to radiation health and asbestos exposure. Later, he became the senior flight surgeon at Naval Air Station Whiting Field in Florida, overseeing the health and readiness of more than 1,500 aviators and air traffic controllers. Now, part of Monument Health, Dr. Storch brings that same depth of experience to his civilian patients. He's board certified in occupational and aerospace medicine, and after 25 years in hospital and clinic settings, from surgery to primary care, he's here to talk about a topic that connects his worlds of aviation and medicine, FAA physicals, and civil surgeon exams. Welcome back to the show, Doctor. I appreciate having you back.
Yeah, thanks for having me. This is
you
great.
Bet. Now, you said I have to call you Doc, so I'm going to try really hard to do that today. Why does that resonate with you so much? Why is doctor not what you?
It's just too formal. I started in the Navy as a hospital corpsman, and they're called Doc by fellow sailors and Marines. And then when I returned to the Navy as a physician, I was just Doc everywhere I went on the ship and in the hospital. It's just Doc.
How did you get started? I mean, did you want a career in medicine, or were you wanting to be in the military, or did you want to do both?
I started into my Navy career as a corpsman, like I said, and my original intent was to do the Nuke Med program for the Navy, and I took that test and I passed it, and I was placed on a waiting list. And then in the meantime, the recruiters have their hooks in you; they don't want to let you out of their sight, and so they say, "Hey, pick another job description." And I said, "Okay, what's this?" And I looked through all these, and there's a lot of cool, sexy jobs out there, jumping out of helicopters and saving people, or going overseas and kicking down doors and stuff. And I just said, what am I going to do when I get out of the Navy? So I was looking after the Navy, what am I going to do, right? And so I said, well, the Navy hospital corpsman seems like a neat gig. My mom was an RN, and it seemed like that would be a very good opportunity for me to get into medicine. So I did, and I chose that. And then when an opportunity opened up to go to the Nuke Power School, I said, no, I'm going to stay hospital corpsman.
So it just felt like the right thing to do.
It did. And then when I was a corpsman, I read an article in Reader's Digest, of all books, that
now, for the kids listening out there right now, Reader's Digest.
It was an article entitled "Free Medical School," and it detailed the Uniformed Services University of Health Sciences, which is in Bethesda, Maryland, and it is in fact a free medical school. It's the military's medical school where they trained Army, Navy, and Air Force physicians and public health service.
Wow. We had a podcast here a week or so ago too, where I was talking to another doctor who went into the military, did his 4 years, because the military said, look, you come do 4 years, we're going to pay for all this.
Right.
And
that's the route I ended up taking. Yeah.
That's a hard argument to ignore.
Right. Yeah.
When
that
can
sure
all
was.
get paid for.
Right. When I got into medical school, so I was left out on the waiting list for uniformed services and didn't matriculate there. So had to pivot and go to a civilian medical school. And then once I got accepted, I'm like, how am I paying for this? And so, hello Navy. So I did what's called a HPSP, or Health Profession Scholarship Program, to go to medical school. And they picked up tuition, books, fees on a year-for-year basis. Every year of scholarship, you have to pay them back a year.
I think a lot of people that are interested in getting into the medical field should consider that route, shouldn't they? I mean, would you recommend it?
I would. It's not for everybody.
Sure.
It's not for everybody, but my mom said when I joined as a hospital corpsman, she said, well, if you don't like it, at least that's something you don't want to do, right? That the military is not for you.
Yeah.
And so, that's a long way to go to find out you don't want to be in the military right after medical school and you owe them 4 years. So, but there are those that do that. They do they take their military scholarship and they do their service as a physician in whatever branch. And then they get out.
Well, how did you get into these disciplines specifically, like an FAA? the aspect of being an FAA, doing those physicals and the civil surgeon stuff, which we'll talk a little bit down the road.
Right.
What led you into that?
Well, I spent almost 4 years on the USS Oak Hill, and a buddy of mine called me and said, "Hey, what are you gonna do when you get off that ship? You know, you don't have a residency." And I said, "You're right, I don't. What am I gonna do?" And I said, "I would like to do this job on an aircraft carrier." I said, "I'd like to go to a larger platform." And he said, "You got to be a RAM." I said, "I don't know what that is." "What's a RAM?" He said, "It's a residency in aerospace medicine. You got to go down to Pensacola. You got to do that RAM program, and those are the folks that end up being the senior medical officer on an aircraft carrier." So I applied. I was accepted. I did that program. It's a aerospace and occupational medicine program that also requires you to get your master's in public health, and then it sets you up to be that senior medical officer on an aircraft carrier. And when you have that job, you're one of 10 people in the world with that job.
Oh, you're kidding! That's
cool.
it.
Yeah. So that was my goal, and then I graduated residency and didn't get an aircraft carrier. I don't think anybody from my graduating class did. And I went to Whiting Field in Pensacola. That's where I was. We had a home up there in Pace, Florida, and became the senior medical officer at Whiting Field. And I did that as my twilight tour before I retired.
So what led you up here then to Rapid City?
Frankly, Monument had an occupational medicine program that checked all the boxes that I was looking for. It was a pre-existing program, or a turnkey practice, as I would call it. They had Dr. Ungs was here, my former colleague, so I wanted someone to show me the ropes, especially when it comes to work comp, because there isn't workers' compensation in the Navy, and it was going to be a large part of what I do. And South Dakota was nice.
This part of the state. This part of the state's very nice.
It was very nice, and it was comparable in terms of COVID lockdowns or lack thereof to Florida. I was coming from Florida. Florida was pretty wide open. Certainly, there were some things that were shut down, but South Dakota was very similar in that regard.
Right. Well, let's talk about. Let's start with the flying side of things here. Most people, I don't think, really realize how strict the FAA is when it comes to medical exams.
Right.
So what is the main goal of these exams?
So the main goal of an FAA exam is purely safety of flight, right? They don't want you to have a medical emergency at 30,000 feet. That's probably a bad time to become incapacitated due to some medical problem, right? So that is the overarching goal. But let's be clear: the FAA isn't out there to put a bullet in you and say you can't fly, right? They have a girl who flies aircraft. She has no arms, so she flies with her feet, right? So I just, I tell my airmen when they're worried, first timers coming in, maybe they have some sort of disease process they're worried about. I say, look, we're not out to keep you from flying. We just want to make sure you can do it safely.
Right. Yeah. Okay. Well, what's at stake for pilots who don't pass?
So if you don't pass, and we'll say pass at my level. So if you come in and you have a disease process that maybe or is more than likely incompatible with flight, I'm going to defer your application to the FAA. And that's part of our training. The FAA says, look, defer to us. Let us be the bad guy.
All right.
So the FAA will look at it. If they require more information, or they want some notes or studies or verification from your healthcare providers that you're safe, then they're going to ask for those things. But if you come and see me and you have a disqualifying condition, and there's about 15 of them, I'm going to defer you to the FAA. So I'm not going to say no. I'm going to say the FAA will make the decision.
What are a couple of those 15 that would be?
Let's say epilepsy.
Oh, sure.
Right. Severe cardiovascular disease, or a heart attack, heart transplant, certain psychiatric disorders, illegal drug use or substance abuse.
Okay. Has that list been expanded in your practice? Did it start out as like 10 and now it's to 15, or
it's been 15
it's always
since
been the same?
I started? There's 15 that they describe as disqualifying conditions.
Got it.
But even then, even though they label them as disqualifying conditions, they say defer to us.
Now you're board certified in aerospace medicine as well, which To me, that sounds like something right out of a movie, really. Aerospace medicine. What's unique about caring for people in who work or travel in like high altitude environments like that? Well, hold on. What is aerospace medicine to start with?
So aerospace medicine, we really focus on the factors of flight that affect the human body and human physiology.
Oh, okay.
Right.
Mm-hmm.
So we're able to identify like spatial disorientation and again, it all comes down to safety of flight. So is the airman safe to fly, and recognizing those conditions that exist at altitude that don't exist at sea level.
Mm-hmm. Yeah. Okay, and that's
it.
That made it really well. Okay, now you took away the cool movie part of it, I guess, really quick.
And that's most of it is physicals. I'll be honest with you. When you're a flight surgeon, what are you doing? You're doing a lot of flight physicals. You also, like we did on the ship, we call it walking our spaces. You go to the squadrons and you walk around, make sure everybody's doing okay. Not necessarily from a health perspective in terms of physiologically doing well, but also from a mental health, right? Walk around so they know you know them, and you can keep an eye on them and make sure everything's going well because they're under a lot of stress.
Well, yeah. Has mental health become a bigger issue in your work? Because it seems like medicine and doctors are really starting to focus on it more, starting to understand that they work together.
Yeah.
Is that the same way for you?
Absolutely. Absolutely. When I started in the Navy as a corpsman and then ended in the Navy as a physician, looking back, I could see definitely there was a change in focus, instead of sucking it up and just, plowing forward and pushing everything down. It became more acceptable, I'll say, to maybe have some mental health issues, and you were encouraged to seek help for those things. Yeah.
All right, let's go to the civil surgeon.
Sure.
I had never heard this term before getting to talk to you today.
Right.
And
I had never heard this term until I got out here.
It's an odd term in its history for the way I saw it. Apparently, surgeon was the standard term for a physician in like a military or official government capacity back in the day.
Right, and they still use that term, like battalion surgeon or flight surgeon. They still use that, but flight surgeon's a misnomer. I'm not a pilot, nor am I a surgeon. But it's just a term that they've carried forward.
And so then they took that from that official capacity and moved it into the civilian world. So is that kind of how that? To your understanding, how that works?
I'll be honest, I don't know the history of civil surgeons, but it sounds reasonable, right? I think we could come to the reasonable conclusion that
it's a weird, but that's the government in a nutshell sometimes too.
Right.
We don't always understand it and why they do the things they do. But what is a civil surgeon and a civil surgeon exam specifically?
Right.
To me, this didn't match with what it does either. The name.
No, it doesn't. So what we do is, you have to apply to be a civil surgeon, and the USCIS, United States Citizenship and Immigration Services, gives you the ability to do these civil surgeon exams, and they bestow upon you the title of civil surgeon. And so what we do is we do I-693 medical exam or application for medical exam.
Now, this is for people that are wanting to become Americans, that are immigrants.
This is the first step. So this is for folks that need that green card. So the application for permanent residency. Okay. So you have visas. That's for school, work. You're here for a set period of time. Then you have your application for permanent residency, or what we call the green card, right? And part of that application process requires a completion of an I-693 medical exam, and that's what we do. And that exam is looking for signs of communicable disease. We draw some tests looking for tuberculosis, syphilis, gonorrhea, and then an in-depth health history. Make sure there's no illegal drug use, substance abuse, some psychiatric disorders with harmful behavior, or any other communicable disease. And then make sure they have the required vaccinations or vaccination history. And that's what we do in our office.
That happens a lot here in Rapid City?
Absolutely. I get a couple a week. In fact,
no kidding.
I've seen folks from as far away as Montana. People have driven, 8-10 hours to come see me. Yeah.
It seems like that'd be a purely coastal thing for when people get here.
It's you would think, but they, if someone comes here on a visa and then they get married and then they want to,
sure,
right? They meet the love of their life in college, and then they want to stay here. So now they're applying for permanent residency, and typically that's a pathway to citizenship, and now that's a whole nother process and application for naturalization. But the green card and the medical certificate, or the I-693 application, is a one-time thing as far as I understand. Looking through it, the naturalization process, you have to be a green card holder first, but nowhere does it say you need another physical.
Why can't just a normal doctor do this?
Well, I don't know. You can do them as a military officer.
Okay.
Physician, obviously.
Yes.
But as an officer and a physician in the military, you can do them through no special training, and I didn't have any special training. But I think they just want a thorough background, and that's why they have an application process. But there's no additional training, if that's what you're asking.
Yeah,
so
okay.
Any physician could do them. It's just a matter of applying. And maybe, like the FAA, if there's too many FAA aeromedical, medical examiners in one area, maybe they're a little hesitant to put a new guy in that area if it's already flooded with examiners. So I don't know if USCIS does the same thing or not.
Got it.
So
okay.
My colleague was a civil surgeon, and Monument wanted to continue that program, and I was more than happy to do that.
Oh, how many people are in this whole department with you then? How many people are?
How many physicians?
Yeah.
It's just me.
Is it just? No kidding.
I'm it.
It's great job security right there is what that is.
A lone ranger, alone and unafraid.
Well, like I said, you've got over 2 decades of experience doing this kind of thing. You've seen medicine evolve quite a bit. Are there things that have changed in how exams are handled or how patients approach them that you've seen over this 20 years?
Well, sure. When I was now granted, I wasn't seeing patients when I was a corpsman. I went to OR school and became a surgical tech. So I was in the operating room. Patients I saw were asleep most of the time. But I would say the advent of the internet has definitely changed.
Oh, sure.
The patient interaction. We get patients that come in and they've already looked up what's going on, right? They're testing
how do you feel as
right?
a doc
They're testing
about that,
you.
though? Do you like that?
It doesn't bother me.
Okay.
It doesn't bother me. I don't know how long they spent on the internet or where they went. And I encourage my patients, look, hey, you have, if you want to go and look up your condition on the internet, that's fine. But I caution them to stay out of forums because those are just wrought with opinion.
Absolutely.
And you don't know who you're talking to on there. But yeah, I don't see it as a problem in my practice.
Right.
Now there's probably physicians out there that have a 180-degree opposite opinion. But for me, it doesn't really impact.
Well, I'm assuming in some sense it leads to maybe occasionally better questions that they might ask. But yeah, I mean that's a really good point. I think you're kind of the first one that's ever pointed that out. Yeah, it is okay, I think, to go online to do a little.
Sure. Who doesn't?
But yeah, stay out of the comment section of a lot of them.
Right, and that's no guarantee.
Right.
I mean, you could go to Google or WebMD, and it's like, these are my symptoms, and WebMD says death is certain.
Yeah, you're dying in 6
exactly.
minutes. So
you do it at your own peril, right? Yeah.
What is if you had to look at both of the things that you kind of specialize in, helping pilots stay in the air, helping people take off on a new life here in the United States. What do you find most rewarding in what you do right now?
I do find the immigration physicals rewarding. Again, like you said, these are folks that are trying to apply for permanent residency, and that's the first step in naturalization and becoming a U.S. citizen. So that is rewarding, absolutely. But the other half of my practice, I do a lot of work comp, so I see a lot of injuries at work and helping those folks get back to work. That gives me satisfaction. Keeping pilots flying, keeping DOT drivers driving, it's all part of it. And I enjoy all of it.
Well, and I know we talked about DOT and some of those drivers back in a podcast very early on when you were here. I would encourage people to go listen to that one as well. Do you still deal with pilots like at Ellsworth? Or is that a whole other thing now?
I only deal with them if they're getting out, and I've done a few that are they're bomber pilots out at Ellsworth, and they're now going to go fly for an airline or an air transport company, and they're coming to see me to get their medical certificate.
Oh, okay.
Yeah. And when I started doing this 5 years ago, I did second and third class flight physicals for the FAA, and then they asked me to be a senior examiner, and now I do first class, which is your air transport pilots, so your Delta pilots, your United and American pilots. So now I do class ones as well.
Outside of the military, if you take the military pilots out of it, what's the most challenging flights for a pilot in civilian life? Are there some that are a little more challenging than others?
Well, I'm not a pilot. So
when you talk to them,
I got it, and typically we don't talk about their flights and stuff. I'll ask in passing most of the time, who do you fly for? What do you fly? Sometimes I know what the aircraft is. Sometimes I don't. Yeah, right? I know what a 747 is. Right. Yeah. But some of the other stuff that they bet you, I have no idea what it is, because I'm not a pilot. Yeah. And I don't pretend to be a pilot.
Did you ever want to be? Did you ever think that was something?
Oh, absolutely, right? Yeah. When Top Gun came out and I saw it in the theater, the first thing I mentioned to my recruiter. He's like, "What do you want to do?" I'm like, "I want to fly airplanes." He's like, "All right, calm down." You don't have a degree. Right. You're right. You haven't graduated high school. Yeah, easy. Man. Pump the brakes there, sport. Calm down, Maverick. Yeah. So yeah. Of course, I wanted to fly aircraft. So But I did get a little bit of flying in the Navy. As a flight surgeon, you do get to go up with your pilots. You're in their spaces, walking them all day. They're inviting you to come fly with them. But let's be honest, I was self-loading baggage. I was not a pilot, right? And honestly, after everything I'd done, the biggest fear I had getting into the aircraft was talking to the tower. There is a special way that those guys talk to the tower. There's a roll as it comes off their tongue. They have it all down. They got the lingo. And man, I just didn't want to sound like an idiot on the radio to everybody who can hear you, right? And you click on and you want to ask for permission to taxi onto whatever taxiway or takeoff or whatever. I would beg the pilot, please don't make me talk on the radio.
You're sitting in there. Go to the left part of the part where the thing goes.
That's right. That's right.
You didn't want to sound like that at all.
No, I did not. Yeah. So I would just, I'd let them know ahead of time, look, I'll do whatever you need me to do. Take off, land, we can go do aerobatics and stuff. But please don't make me talk on the radio.
But you did. Look you did this for almost 24 minutes right now, Doc.
Wow.
See, you did a great job.
Right.
So I think next time you're offered, you go do it and you say, look, I'll take it over. All right. Maybe. Dr. Chad Storch from Monument Health, thanks for coming in and talking again. Doc, I appreciate it. And, whatever else pops into your head, we'll do it again, okay?
Sure thing.